Picture this. You're cruising down Interstate 80 through Nebraska, windows down, that endless horizon stretching out before you like a postcard of America itself. Golden cornfields swaying in the breeze, red barns dotting the landscape, and that big blue sky that seems to go on forever. This is the Heartland, right? The place where everything's supposed to be stable, safe, and predictable, where neighbors still wave at strangers and Friday night football games are the biggest excitement in town. But what if I told you there's something darker lurking beneath that picture-perfect surface? Something that's shattering lives and destroying families in ways that would absolutely shock you. Because right here in Nebraska, in this state that most people drive through without a second thought, there's a crisis brewing that's tearing communities apart from the inside out. We're talking about over 2,700 people homeless on any given night in 2024 alone. That's a 10.5% jump from just the year before. And in Omaha, the state's biggest city, the number of people sleeping rough in tents and cars has exploded 8 times over since 2013. 8 times. Can you imagine that? We're not talking about some gradual increase here. This is a full-blown explosion of human suffering happening right under our noses. And here's where it gets even more disturbing. This isn't just about people falling on hard times. Drugs are woven into this nightmare like a poisonous thread, with overdose deaths claiming a Nebraskan life every 3 days. Every 3 days. Think about that for a moment. While you're going about your normal week, working, spending time with family, watching Netflix, someone in Nebraska is losing their life to an overdose. Now I know what you're thinking. Nebraska doesn't have the overdose rates of West Virginia or Ohio, right? And you'd be correct. The state actually has some of the lowest overdose death rates in the country. But here's the thing that's going to blow your mind. Even with those relatively low numbers, people are still dying at an alarming rate, and it's creating a ripple effect that's destroying entire communities. Let me paint you a picture of what's really happening here. According to the latest data from 2025, Nebraska recorded somewhere between 300 and 350 total drug overdose deaths in 2023, with about 70% of those involving opioids, primarily fentanyl. Now those numbers might seem small compared to states like Pennsylvania or California, but remember, we're talking about a state with less than 2 million people. When you break it down, that's about 10 to 12 deaths per 100,000 residents, and each one of those deaths represents a family destroyed, a community wounded, a life cut tragically short. In Lincoln, which is the state capital and home to the University of Nebraska, there were just 6 overdose deaths from January to August 2024. 6 might not sound like much, but consider this. That's 6 families who got that phone call no parent, no spouse, no child should ever have to receive. And behind each of those statistics is a story of addiction, desperation, and a system that failed someone when they needed help the most. But here's where the story gets even more complex and heartbreaking. The people dying from overdoses aren't living in isolation. Many of them are part of Nebraska's growing homeless population, caught in a vicious cycle where homelessness drives people to drugs, and drugs drive people to homelessness. It's like a perfect storm of human misery, and it's happening in a state that prides itself on Midwestern values and taking care of your neighbors. Let's talk about what's driving people onto the streets in the first place, because this is where the story gets really infuriating. Nebraska likes to brag about being affordable, and on paper, it looks pretty good. The average rent statewide is around $10.95 a month as of September 2025. Compare that to New York or San Francisco, and it seems like a bargain, right? But dig deeper, and you'll discover a housing crisis that's absolutely devastating for working families. In Omaha, if you want a decent 2-bedroom apartment, you're looking at $1,200 a month on average. In Lincoln, it's around $1,050. Now those numbers might not shock you if you're used to coastal prices, but here's the kicker. There's a massive shortage of 37,000 affordable units for low-income families. Let me repeat that because it's so important. 37,000 units. That means for every 100 extremely low-income households in Nebraska, Only 37 rental homes are available and affordable. The math is brutal and unforgiving. Over 100,000 renters in Nebraska are what economists call cost burden, meaning they're spending more than 30% of their income on housing, and 25% of renters are severely burdened, spending 50% or more of their income just to keep a roof over their heads. Imagine trying to feed your kids, pay for gas, buy clothes, handle unexpected medical bills, when half your paycheck is already gone to rent before you've even bought groceries. This housing crisis is hitting families in ways that would break your heart. I came across a story about a single mother in Omaha who was working at a warehouse, doing everything right, trying to provide for her kids. Then her landlord raised the rent by 5.5% in 1 year. Just like that, she couldn't afford her apartment anymore. One eviction notice later, she's couch surfing with relatives while her children miss school because they don't have a permanent address. This woman wasn't addicted to drugs, wasn't unemployed, wasn't doing anything wrong. The system just failed her, and her kids are paying the price. But it gets worse. In rural Nebraska, things look better on the surface with rents around $800, but there's a cruel catch. There simply aren't enough options. When there's only 1 or 2 rental properties in an entire town, landlords can charge whatever they want. And with home values in some rural areas skyrocketing 122% since 2010, even long-time residents are being priced out of their own communities. Picture a farming family that's lived in the same area for generations, watching their kids grow up knowing they'll never be able to afford to stay in their hometown. The eviction crisis is real and it's accelerating. Evictions jumped 12% in 2024 as COVID aid dried up. First-time homelessness rose 15% in the same period. These aren't just numbers on a government report. These are families, veterans, elderly people on fixed incomes, being thrown onto the streets because the math of survival doesn't add up anymore. Now let's talk about who's ending up homeless, because this might surprise you. We're not just talking about the stereotypes you might have in your head. 25% of Nebraska's homeless population are what's called chronically homeless, meaning they've been living on the streets for over a year, often struggling with untreated mental health issues like depression or PTSD. Many of these are veterans who served our country and came home to find that the support systems they needed simply didn't exist. Domestic violence is a huge factor that most people don't think about. Thousands of women and children in Nebraska flee abusive homes every year, only to discover that there aren't enough shelter beds available. So they end up in their cars, in motels they can't really afford, or worse, going back to their abusers because at least that's a roof over their heads. The choice between homelessness and violence shouldn't exist in America, but it does every single day. And then there are the kids aging out of foster care. Picture this. You turn 18, the state says you're an adult now, good luck, and suddenly you're on your own with no family support network, no place to go, no real-life skills because you've been bounced around the system your whole childhood. Is it any wonder that so many of these young people end up on the streets? The racial disparities are staggering and shameful. Black Nebraskans make up only 13% of the state's population, but they represent 40% of the homeless. This isn't an accident. It's the result of decades of systemic inequalities, from historical redlining that kept black families from building wealth through homeownership, to ongoing discrimination in employment and education. The American dream has never been equally accessible, and nowhere is that more obvious than in homelessness statistics. In rural areas, there's what experts call hidden homelessness. People are couch surfing with relatives, sleeping in their cars in Walmart parking lots, doubling up with friends because there's literally nowhere else to go. These people don't show up in official counts, which means the real scope of the problem is even worse than the shocking numbers we're already seeing. But here's where the story takes an even darker turn. Drugs aren't just a separate problem that happens to affect some homeless people. In Nebraska, homelessness and substance abuse are locked together in a death spiral that's destroying lives at an accelerating pace. About 20 to 30% of Nebraska's homeless population deals with substance use disorders, which is way above the state average of 8%. Think about the logic of this for a minute. If you're living on the streets, if you're cold, hungry, scared, and hopeless, drugs become a way to escape that reality, even if it's just temporary. Opioids like fentanyl and methamphetamine aren't just popular because they're available. They're popular because they offer a brief respite from a life that's become unbearable. The problem is that brief escape makes everything worse in the long run. The cycle is vicious and predictable. Addiction leads to job loss, which leads to evictions, which leads to homelessness. And once you're homeless, the instability, the constant fear, the inability to store medications safely or get to treatment centers makes it nearly impossible to get clean. It's like being trapped in quicksand where every movement you make just pulls you down deeper. Homeless individuals in Nebraska face a 60% higher risk of overdose because they can't store naloxone, the life-saving overdose reversal drug, safely. They can't get to hospitals in time when something goes wrong. They're using drugs in unsafe conditions, often alone, where no one can help if they overdose. The mortality statistics are heartbreaking. People experiencing both homelessness and addiction die decades earlier than they should, robbed of any chance at recovery or redemption. The drug situation in Nebraska has its own unique characteristics that make it particularly dangerous. Fentanyl is being smuggled in via the interstate highway system, mixed with other drugs in ways that users can't detect. Someone thinks they're buying heroin or methamphetamine, but it's been cut with fentanyl, and that's all it takes. One hit of fentanyl-laced meth can end a life instantly. Polysubstance use is rampant among homeless networks. People are mixing different drugs, often because they can't afford or can't find their drug of choice, so they take whatever's available. This makes overdoses more likely and treatment more complicated. How do you help someone recover when they're addicted to multiple substances and living in conditions where stress and trauma are constant? In rural areas, methamphetamine drives a different kind of homelessness. Rural meth users often lose their homes when their addiction spirals out of control. But unlike urban areas, there are fewer services, fewer treatment options, fewer places to go for help. 20% of rural shelter clients report issues with drugs other than opioids, primarily meth, which creates different challenges for treatment and recovery. The economic impact of this crisis is staggering. Nebraska loses about $500 million a year to drug-related healthcare costs, lost productivity, and criminal justice expenses, much of it tied to homeless populations. That's money that could be going to schools, to infrastructure, to economic development, instead being spent on emergency room visits, police responses, court costs, and incarceration. The social impacts are just as devastating. Encampments near highways become hotspots for discarded needles, creating public health scares. There have been HIV spikes from needle sharing in certain communities. Kids walking to school are finding drug paraphernalia in parks and playgrounds. The crisis isn't contained to just the people directly affected. It's spreading through communities like a poison, affecting everyone. Now you might be thinking, surely unemployment is part of this problem, right? If people had good jobs, they could afford housing and wouldn't turn to drugs. But here's where Nebraska's story gets even more complicated and, frankly, more frustrating. The state's unemployment rate is actually incredibly low, 3.0% as of July 2025, which is the sixth lowest in the entire United States. Nebraska has been adding jobs steadily in healthcare, agriculture, and other sectors. But low unemployment doesn't tell the whole story. Behind that impressive statistic are some ugly truths that explain why people are still ending up homeless and addicted despite the availability of work. First, there's massive underemployment. People are working, but they're not earning enough to live on. When the median household income is $71,000, but 13% of Nebraskans still live in poverty, something's seriously wrong with the equation. In rural counties, there's hidden joblessness that doesn't show up in the statistics. Young people are leaving for better opportunities in other states. The population is aging, and there aren't enough workers to fill available positions. But the jobs that are available often don't pay enough to afford housing, especially with rents rising faster than wages. For people experiencing homelessness, 15% cite job loss as the initial trigger that started their downward spiral. And drugs play into 10% of unemployment cases through addiction-related absences, criminal records that make people unemployable, and the chaos that comes with active addiction. Nebraska has snap bans for people with drug convictions, which affects 5 to 10% of homeless folks, keeping them trapped in poverty even when they're trying to get back on their feet. The racial disparities show up in employment too. Black unemployment in Nebraska hovers between 6 and 8%, while Hispanic unemployment runs 4 to 5%. Even when the overall numbers look good, certain communities are being left behind, and those are often the same communities that end up overrepresented in homelessness statistics. Let me tell you about what this looks like on the ground in Omaha, because that's where the crisis feels most acute and visible. With 1,609 homeless people counted in 2025, the city's unsheltered population surge is turning parks and underpasses into makeshift camps that look more like something you'd see in Los Angeles or Seattle than the heartland of America. I read a story that still haunts me about a veteran who served his country honorably, came home with PTSD, and found that there was no VA housing available when he needed it. He turned to prescription pills to deal with the psychological pain, lost his job when the addiction took over, and ended up living in a tent by the Missouri River. The drugs didn't cause his problems initially, but they amplified everything, turning what might have been a temporary setback into a life-threatening crisis. He nearly died from an overdose before getting help, and his story is being repeated hundreds of times across the state. In Lincoln, things look a little better on the surface. Overdose deaths dropped to just 6 from January to August 2024, which sounds like progress. But that's cold comfort when you consider that statewide, fentanyl smuggled via the interstate highway system is still claiming lives every 3 days. The drugs are coming through Nebraska whether the state wants to acknowledge it or not, and they're finding their way to the most vulnerable people. Rural Nebraska presents a different kind of crisis. It's quieter, less visible, but equally devastating. Methamphetamine labs in the Panhandle create their own set of problems. People suffering from addiction in small towns often do so in complete isolation, with limited treatment options and no anonymity. When everyone knows everyone else's business, admitting to drug problems or homelessness becomes even harder. The broader impacts of this crisis extend far beyond the individuals directly affected. Nebraska is losing about $2 billion yearly when you factor in all the costs. Emergency services, foster care for children of addicted parents, lost tax revenue from unemployed workers, increased crime, healthcare costs, and the opportunity costs of having people trapped in cycles of addiction and homelessness instead of being productive members of society. Socially, the crisis is fracturing communities in ways that are hard to measure but impossible to ignore. In Omaha, there are heated debates over encampment clearances, with compassionate people wanting to help but safety-conscious residents worried about needles, crime, and public health risks. Social media is full of arguments about the best way to handle the crisis, with some people calling for more services and others demanding law enforcement crackdowns. The health impacts go beyond just overdose deaths. There are secondary epidemics like hepatitis from sharing needles, HIV transmission, and other infectious diseases that spread more rapidly among homeless populations. Children in unstable homes face lifelong trauma, higher dropout rates, and poorer mental health outcomes that will affect them for decades to come. Economically, businesses in rural areas struggle with labor shortages that are tied to addiction. When working-age adults are battling substance abuse disorders, they're not available for employment, which hurts local businesses and economic development. Urban growth is straining resources as cities try to cope with increasing numbers of people who need expensive services but can't contribute much in taxes. This isn't just individual suffering we're talking about. This crisis is literally dragging the entire state down, turning that famous Heartland pride into quiet desperation. The image of Nebraska as a stable, family-friendly place where people take care of each other is being challenged by the reality of tent cities and overdose deaths. But here's where the story takes a more hopeful turn, because Nebraska isn't just sitting there letting this crisis destroy communities. The state is fighting back with some innovative and effective programs that are actually making a difference, even if they're not getting the attention they deserve. The Department of Health and Human Services runs something called the Drug Overdose Prevention Program, which has distributed naloxone, the overdose reversal medication, so widely that it reversed over 1,000 overdoses last year. Think about that for a moment. Over 1,000 families didn't lose someone they love because this program existed. Over 1,000 people got a second chance at life, a chance to get clean, to rebuild relationships, to become productive members of society again. Housing First initiatives have been particularly successful, with 90% retention rates by prioritizing getting people into stable housing before requiring them to address addiction or mental health issues. This approach recognizes something that should be obvious but often gets lost in policy debates. It's nearly impossible to get clean when you're sleeping on the street. Give someone a safe, stable place to live, and suddenly recovery becomes possible. The Nebraska Commission on Housing and Homelessness has been pushing hard for more affordable units, and they've had some success. About 500 new affordable housing units were added in 2024, which isn't nearly enough, but it's a start. Legislative Bill 252 in 2025 boosted opioid funding specifically for rural outreach, recognizing that the crisis looks different in small towns than it does in cities. Community groups in Omaha are providing peer support, where people who have been through addiction and homelessness themselves help others navigate the system. These programs are incredibly effective because they're run by people who understand the reality of the streets, who have been where their clients are, and who can offer hope based on their own recovery experiences. Needle exchange programs have cut infections by 20%, which might seem like a controversial approach to some people, but the evidence is clear. Harm reduction saves lives and saves money. It's better to keep people alive while they're working toward recovery than to let them die from preventable diseases. Workforce programs are targeting underemployed folks who face addiction barriers, providing job training and support services that address the whole person, not just their employment status. These programs recognize that you can't separate addiction, homelessness, and unemployment into neat categories. They're all connected, and solutions need to address that reality. The results are encouraging, even if they're not happening fast enough. Overdose deaths are down compared to previous years. Homelessness growth has slowed in some areas. The programs are working, but they're severely underfunded and understaffed for the scope of the problem they're trying to address. Here's what's really frustrating about this whole situation. Nebraska has all the tools it needs to solve these problems. The state has record employment, vast amounts of land for development, relatively low costs of living, and a culture that values helping neighbors. So why can't they build those 37,000 affordable housing units that are desperately needed? Why are people still dying from overdoses when naloxone is so effective at saving lives? It comes down to political will and priorities. It's easier to ignore problems when they're not affecting you directly. It's easier to blame individuals for their addiction or homelessness than to acknowledge the systemic failures that created the crisis in the first place. It's easier to complain about seeing tent cities than it is to fund the housing and treatment programs that would eliminate them. But change is possible. There are stories of hope scattered throughout this crisis that prove recovery and stability are achievable when people get the support they need. I think about the Omaha shelter volunteer who helped a family escape the cycle of homelessness and addiction, connecting them with housing, treatment, and employment services. That family is now stable, contributing to their community, and their kids are in school instead of living in a car. There's the former meth user in rural Nebraska who got clean through a treatment program, found work in agriculture, and is now mentoring other people in recovery. His life went from hopeless to hopeful because someone invested in his recovery and gave him the tools he needed to rebuild. These individual success stories prove that the programs work when they're properly funded and implemented. The question is whether Nebraska will scale up these solutions to match the size of the problem, or whether the crisis will continue to grow while politicians debate and communities suffer. As we think about the future, it's important to understand that Nebraska's crisis is really America's crisis in miniature. The same forces driving homelessness and addiction in Nebraska are at work across the country. Affordable housing shortages, wage stagnation, inadequate mental health services, and drug policies that criminalize addiction instead of treating it as a public health issue. The difference is that Nebraska is small enough and stable enough that solutions are actually achievable. If the state committed to building those 37,000 affordable housing units over the next 5 years, if it expanded addiction treatment and mental health services, if it addressed the racial disparities in homelessness and unemployment, Nebraska could become a model for how Heartland states can address these challenges. But that requires acknowledging that the crisis exists, even in places that seem safe and stable on the surface. It requires understanding that homelessness and addiction aren't moral failings but systemic problems that require systemic solutions. It requires investing real money in programs that work, even when they're not politically popular. The clock is ticking. Every 3 days, another Nebraskan dies from an overdose. Every night, over 2,700 people don't have a safe place to sleep. Every month that passes without serious action means more families destroyed, more children traumatized, more communities damaged. But the story doesn't have to end in despair. Nebraska has everything it needs to turn this around: the resources, the knowledge, the programs that work. What it needs now is the collective will to treat this crisis with the urgency it deserves. Because in the end, this isn't really about statistics or policy debates or budget allocations. This is about whether we're going to live up to those Heartland values we claim to cherish. This is about whether a kid in Lincoln or a veteran in Omaha should have to face addiction and homelessness alone, or whether their community will wrap them in support and give them the tools they need to rebuild their lives. This is about whether Nebraska will remain a place where the American dream is possible for everyone, not just those lucky enough to be born into stable families with good jobs and affordable housing. This is about whether we're going to be the people we claim to be, the neighbors we say we want to have, the society we tell ourselves we've already built. The choice is ours. The time is now. And the people suffering on Nebraska's streets can't wait much longer for us to make the right one.